We turn now to our conversation with Vice President Mike Pence, the head of the White House Coronavirus Task Force. We spoke with him Saturday about the spike in new cases. Mr. Vice President, some of them are having the biggest spikes are the big ones: Texas, California, Arizona. Are you concerned?
Well, we're monitoring very closely new cases in Florida, Texas, Arizona, and California. In fact, I'll be traveling with members of our team to several of those states over the next several days to make sure and get a ground report. But what the American people should know is that because of the leadership that President Trump has provided, because of the extraordinary innovation that we have brought to this task, we're in a much better place to respond to these outbreaks than we were 4 months ago. I mean, today we are now testing 500,000 Americans a day. We're able to do a great deal more surveillance and community testing than ever before. We've also expanded our healthcare capacity across the country, literally seeing delivered billions in personal protective equipment, ventilators, and most importantly in this moment is we've seen the development and distribution of therapeutics that have literally been saving lives around the country, and we believe by the end of this year it's likely we'll have a vaccine.
So you say that the country's in a better place in this moment, but the experts say we shouldn't be in this moment we're in, and I'll read you a few. Dr. Anthony Fauci says there's a disturbing surge of infections. The governor of Texas, Governor Abbott, says there is a massive outbreak. In the Wall Street Journal 10 days ago, you said 20,000 cases was a good number relative to where they've been. This week, there have been 40,000 cases. Your level of concern, I understand you're saying what's been done, seems insufficient to the alarm from governors and experts.
No, let me be very clear that we are focused, our entire team is focused on working with governors to make sure that we meet this moment and support the efforts at state levels to provide the kind of steps that will mitigate these new cases. But there's another way, John, that this is different from early on, and that is that one of the things that we've heard in Texas and Florida in particular is that nearly half of those who are testing positive are Americans under the age of 35. That's contributing to the fact that those that are requiring to be hospitalized who are testing positive for coronavirus is significantly lower than it was 2 months ago. And so we really believe that what is happening here is a combination of increased testing. We're able to test a great deal more Americans than we were able to several months ago. But it also may be indication that as we're opening our economy up, that younger Americans have been congregating in ways that may have disregarded the guidance that we gave on the federal level for all the phases of reopening. And I think that's why you see several governors taking action to essentially try and prevent further increases in those new cases.
The spike states are also states that are reopening early, and the administration's focused a lot on the economy, trying to get it reopened.
Right.
The states that are reopening are having some of the biggest problems. Did the reopening happen too early?
Well, all 50 states are opening up again to one degree or another. And I know there's a temptation to associate the new cases in the Sun Belt with reopening, but it's important to remember that states like Florida and like Texas actually began to open up in early May. For the better part of 6 weeks, John, we did not see any significant movement. In my conversations with governors in Florida and in Texas and in Arizona in particular, we're monitoring very closely their hospitalization rate, and we continue to be very confident that they have the supplies and the support and the capacity to give people the level of care that any of us would want a family member to have.
You're talking about being able to monitor the situation. The argument is that the situation shouldn't be existing in the first place. Europe waited longer to reopen, and they have seen less trouble in reopening. In Florida, since Memorial Day, which was a new stage of reopening, cases are up 165%. There were almost 10,000 cases in a single day in Florida. Something happened. And it's not just a question of monitoring. The experts are saying these states walked into a problem with their eyes wide open because they opened early. And that's a mistake which seems to repeat the original mistake, which was to downplay and not take seriously the nature of the threat.
Well, I beg to differ about the reopening, and I beg to differ about downplaying. On the second point, I mean, President Trump suspended all travel from China before the first case of community transmission occurred in the United States.
There were 9 cases when he did
We
that.
stood up, well, no, not, there were cases in the United States of people who had returned to this country, but the first case of community transmission would occur weeks later. And he stood up the White House Coronavirus Task Force. And everything I've described about an unprecedented scaling of testing, the development of billions of medical supplies, ventilators, the development of therapeutic medicines like remdesivir and others that are being developed, the launch in record time of a vaccine development. But as we've arrived at this moment, it's clear across the Sun Belt that there's something happening, particularly among younger Americans, and that's why we fully support Governor Abbott's decision to close bars and limit restaurants. We fully support steps taken in Florida and elsewhere, and we'll continue to support those efforts.
Why not ask people to wear masks?
Well, we believe people should wear masks
Why doesn't the
wherever
president say
social distancing is not possible, wherever it's indicated by either state or local authorities. And you know, the president has worn a mask. I wore a mask on several occasions this week.
Governor Abbott in Texas has said the precondition for opening the economy is wearing a mask. Wear the mask, he said, will keep the economy open. You and the president care a lot about keeping the economy open. The message on masks has been muddled. Why doesn't the president, who has some suasion in the country, come forward and say everybody should wear a mask, which is what all the governors are saying? Why has he been kind of muddling that message?
Well, first, we believe that every state has a unique situation. And I want to be clear, while we're monitoring about 16 states that are seeing outbreaks, it represents about 4% of all the counties in this country. 34 states are not seeing a rise in positivity, and they have different measures, different requirements, and different guidance in place. I mean, one of the elements of the genius of America is the principle of federalism, of state and local control. We've made it clear that we want to defer to governors, we want to defer to local officials,
but Mr. Vice President,
and people should listen to them.
The virus doesn't know federalism. A virus that hits in Texas is in New York tomorrow. This is a problem that requires a coordinated national result, which is what these outbreaks are showing. And so to say states should deal with them individually seems to miss the big fact, which is the virus can go wherever it wants.
John, if we'd have taken that approach, we'd have never had the success that we had in the greater New York City area. We'd have never had the success in Michigan or New Orleans, because from early on, we worked closely in partnership with governors to make sure that they had what they needed, when they needed it, tailored to the unique circumstances in their states. And when you look at the extraordinary progress that we made in New York and in Connecticut and in New Jersey and New Orleans and in Michigan and early on in states like Washington State, where we flattened the curve, we slowed the spread. And we did it at a time early in this pandemic where we were just scaling testing up.
You mentioned testing. To get the economy open again, testing has to happen. The president said if we didn't do testing, we'd have no cases. That's wrong and misleading. Given how important testing is, why is the president saying things that are wrong and misleading about testing?
Well, I think it's inarguable that the historic increase in testing that we've accomplished in this country has played a role in the new cases, particularly among younger Americans. John, I want to remind your viewers that 2 months ago, in most states in this country, we were not testing people that had no symptoms or were below a certain age. We were focusing on seniors. We were focusing on those with symptoms. But now, because of the public-private partnership that President Trump initiated, we're literally able to test anyone in the country that would want a test and come forward. We scaled it with great American innovation.
But Mr. Vice President, 125,000 Americans have died. We're 6 months into this. Testing is crucial to get the economy opened and because of public health. Right. And the President of the United States, with the biggest megaphone on the planet, is saying something about testing that is wrong and misleading. Is that the standard we want for the President of the United States?
John, the President was observing the fact that rising cases, which the media has focused exclusively on.
Why is that vital to getting this problem solved?
Has been in part a result of increased testing. What the media doesn't focus on at all is because of the sacrifices the American people made in those 45 days to slow the spread and the good common sense measures they continue to do, we've continued to see fatalities decline. I grieve for every American family that lost a loved one, for the more than 125,000 Americans that we've lost in this. We're going to continue to take steps to protect the most vulnerable, and testing will be a critical part of that going forward.
But Mr. Testing is critical to protect and to open the economy. In a public health crisis, information and confidence in that information is crucial, as you know so well. So why does the person with the best megaphone say things to undermine confidence in testing? It seems totally at odds with what you're spending all your day doing. This isn't a triviality. This is an important, crucial thing about testing.
Well, John, I just disagree that the president's undermining confidence in testing. He observed
repeatedly
that the volume of new cases is in part a result of the rapid scaling of testing that we've done around the country.
Shortly after our interview with the vice president, we learned that he canceled upcoming campaign events in Arizona and Florida out of what the Trump campaign calls an abundance of caution.